So Butte dose and time recommendations, 0.2 grams per 100 pounds, so 2 grams, not closer than 12 hours prior to competition, maximum 5 consecutive days. So this is the most commonly used one. Now you can also use it at 1 gram twice a day orally, okay? And you can do that as well. Now, you know, this can be, the 2 grams can be IV or oral. I assume everybody knows you never give Butte IM. It's very irritating. It's designed to be used twice a day, okay? It is methocarbamol. And then, but you can't have one of your treatments of your twice a day treatment closer than 6 hours to competition. Let's say that was your morning, you gave it at 6 a.m., you competed at 12, you can still give another dose that evening. You can only medicate the horse with it twice a day, and you can't get closer than 6 hours to competition. Just for length of time here, I didn't put all the other non-steroidals. I will bring up a point on one other non-steroidal, which is Equiox, okay? And that is Firocoxib, okay? And 2 comments I would make about that. One is, this is the only non-steroidal we have in that list that is a what's called a COX-2 inhibitor, and that's how it works. Okay, and so the human equivalent is, it means that it does some very sophisticated things in the body, but it doesn't cause for us the amount of stomach irritation that, say, Butte, Banamine, those drugs do. They're COX-1 inhibitors. Firocoxib, Equiox, is a COX-2 inhibitor. It causes less irritation on their stomach. So this comment that we have on Butte, a maximum 5 consecutive days, which is, we have that comment on every non-steroidal except for 2, okay? And that's because 2 of them work by different mechanisms. One is Firocoxib, okay? You can use it up to 14 days in a row if you want to, okay? And the other one is, which is used by a completely different mechanism because it's the only topical on the list, and that's Surpass, okay? And you can use it up to 10 days in a row, twice a day. The last point I was going to make on Firocoxib is that there is another form of Firocoxib, okay? And that is called Privacox, okay? And that is a small animal dose. And there's a couple interesting things about Firocoxib that are going on right now. It's a great drug, okay, a really effective drug. It takes about 3 days to reach the steady state we talked about, okay? And so you have veterinarians who are trying to then give a lot of drug at the beginning, trying to get steady state faster, okay? And that has caused some problems on positives, okay, because they've given a lot more drug than everyone ever intended them to, and so they've gotten above the level. This drug, when it reaches steady state, you can give it for the whole 14 days and it will never be above the level, okay, at any point you test it. It says 12 hours, but remember what steady state means. It means just what you think it does. It just, you keep supplementing the drug once a day, 12 hours prior to competition, but it just stays at the same level, basically. It doesn't do what Butte does, which is go up and down and up and down and up and down, okay? And so here's the 2 points about it. One is, I don't agree with this loading dose that's being done. And while I don't really think it harms the horse, because this is a very safe medication, is you can get yourself in trouble on the drug testing doing it that way. The other issue is that, again, the Firocoxib paste, Equiox, is a very well worked out drug. There's lots of data on it, okay? And it works very well. The problem is is that when you then take the small animal version of it, there are two small animal versions. One, the one with the little dachshund on it, which is 57 milligrams, is, interestingly enough, very similar to the horse dose, which is about 45 milligrams. And so you'd use the small dog, small animal dose. The big dog is about 225 milligrams, and that is way overdose for these horses, okay, which it goes against common sense here. All right, here's the problem, is that nobody, while the paste that you're treating the horses with is very well worked out, the pills for small animal are not worked out as far as what they do in the horse. As they obviously work because we all use them. We use them in non-competition horses all the time. But if our horses are going to compete, we recommend the people pull off of the pills 3 days beforehand and switch over to the paste. Okay, because the paste has a much more known situation of how it gets out of the body. So I'll just mention that. And it's a little bit like the compounding. Until somebody figures out and documents in the scientific literature how the pills, the small animal pills, work in the horse, and we can make recommendations, if you get a positive and you're on the small animal pills, that's not the approved form. You're just going to get the positive and the fine. There's not going to be a debate about it. We've only seen a very few positives on this. It's a very safe drug. Dexamethasone is another restricted drug. There are 3 ways to give it, okay? And one is IV, and that is 20 milligrams as a maximum, and not closer than 12 hours, maximum 5 days. Okay, and that would be for a bad case of hives. Alternative 2 is a very small dose close in for a very acute dose case of hives. Not closer than 6 hours, 5 milligrams IV. Okay, needs to be IV, not IM. Okay, and small dose, very close. And then this is what we send when we have people go off to shows. We have them and we're worried about a horse getting hives. We give them the 10 milligram oral packets, and we tell them to use it 6 hours prior to the competition, okay? And not more than 5 days in a row if they're having hive issues. And we usually tell them to hose the horse off well, change the bedding, and then use Cortisone shampoo.